My name is Emma Slowey, and I'm going to be presenting over the smallpox virus. So just for a brief introduction, smallpox is one of the deadliest diseases that mankind has ever encountered. It has caused several large epidemics amongst several continents around the globe, and is the only human disease to have ever been completely eradicated using vaccines. Smallpox gets its name from its most characteristic symptom, which is the pox that form on the skin. They're concentrated in the facial region, but they also form on the chest and the limbs as well. So the word pox comes from the Latin word for spotted, because as you can see in the picture, the pustules form spots all across the skin. Smallpox is from the genus Orthopoxvirus, but it has two species, Variola major and Variola minor. Variola major is by far the more prominent species, and it has a very high mortality rate of about 20% to 40%. And under Variola major are four divisions. There's ordinary, which accounts for about 90% of all smallpox cases. Then there's modified, which is a milder form of smallpox only contracted by patients who have already been vaccinated for smallpox. And then flat and hemorrhagic are two divisions that are very rare and have an almost 100% mortality rate. And then variola minor is also relatively rare and has a mortality rate of less than 1%. So the virus itself is composed of double-stranded DNA and it's enveloped. As you can see in the picture, the filaments cover it, which help it attach to its host cell. And it's about 200 nanometers in diameter with a brick shape. And it's one of the largest animal viruses with a genome composed of about 200,000 base pairs. And it's been around for a very long time, but it has a relatively low sequence diversity between the varied viruses, so it's remained the same for most of its history. So the virus itself will use its glycoproteins to attach to the cell's cytoplasmic membrane, to its host cell cytoplasmic membrane, and then it triggers endocytosis so that the host cell will engulf the virus, and once it's inside the cell, it carries genes for transcription enzymes which help it to replicate in the cytoplasm of the host cell, where it forms B-type inclusion bodies. And once it's inside the cell, it will interfere with the cell's innate immunity. So it'll interfere with the interferons, which are the first thing that are supposed to stop viruses, with inflammation and with the complement system. So here in this picture you can see a host cell with a lot of smallpox viruses inside of it once they've already begun replicating. So if you were to see an actual patient who had contracted smallpox, the most prominent symptom would be the pox themselves, and these go through 6 stages. So the first stage is macule, in which the skin is red, but it's still flat, and then it's papule, where the sores become hard and raised, and then vesicles, where the cell walls, the cell membranes rupture and are filled with fluid, and then they become filled with pus in the pustule phase, and they dry over and become, once they desiccate, they become crusts, and once the crusts fall off, scars form because the lesions are very deep. They penetrate all the way to the dermis. So other common symptoms are pretty typical: a high fever, headaches, fatigue, and blindness can occur. It's a rare symptom, and it usually only occurs when the eyes themselves are directly infected. So the virus can enter through one of 4 portals of entry. The most common is the oropharyngeal mucus, the respiratory tract here, but also through breaches in the skin barrier, and then the placenta and eye are rarer portals of entry. Transmission is mostly through close, prolonged face-to-face contact. So if you're helping a patient or if you're having a prolonged conversation with someone, droplets of saliva or pieces of the dried crust will be inhaled by someone, and that's the most common mode of transmission, but also contact with infected bodily fluids or contaminated objects. And then a person is actually contagious all the way up until their last scab is gone. So once the virus is inside the bloodstream, it will migrate to the regional lymph nodes, and it localizes in the small blood vessels of the dermis and the oropharyngeal mucus. So the body's response to the virus, the innate response is obviously a fever, and as I mentioned before, the virus actually codes for proteins which will interfere with the innate immune response. So it contains interferon gamma binding proteins, which will bind to interferons and prevent them from performing their normal function. It'll also interfere with inflammation and the complement system. So the adaptive response, vasodilation of the capillaries, swelling of the endothelial cells, which lead to perivascular cuffing and those lymphocytes and leukocytes rushing to the site. And the pustules actually form from a buildup of dead cells. So as far as treatment goes, there is actually no available treatment specifically for the smallpox virus. If a patient has contracted the virus but they haven't shown symptoms yet, they can receive the vaccine, which can sometimes stop the virus or lessen the symptoms, but there is no specific treatment for the virus itself. So smallpox has been around for a very long time with relatively little variation. So the oldest case that we know of is from 3 mummies that lived from about 1570 to 1085 BC. And this is a picture of Ramses V, one of the mummies. And if you look closely, you can see the pox scarring on his face. So we know it was at least this old, but this is the oldest case that we found. So as I said before, it's been prevalent in many different continents. So in as early as 982 AD, Japan was already establishing hospitals specifically just for smallpox. Probably the most famous case is when the Spanish conquistadors came to the New World and unwittingly infected the entire native population because they weren't exposed to it at all previously. So in 1738, half of the entire Cherokee Indian population was wiped out due to smallpox. And smallpox also threatened the American colonial army during the Revolutionary War. And in 1796, the English physician Edward Jenner came up with a crude vaccine for smallpox, which is the very first vaccine. He used cowpox to infect a small boy, and then he infected him with smallpox, and he survived. And so that was the very first vaccine. As far as prevention goes, we know of variolation, which was an early method of literally taking pus or scabs from an already infected person and infecting yourself with it, hoping to get more minor symptoms and gain immunity to the disease. But after Edward Jenner came up with the vaccine, that became a lot more popular. And in 1980, the World Health Organization declared smallpox to be the first globally eradicated disease. So the last naturally occurring case of smallpox was in the 1970s. And currently, you cannot receive a smallpox vaccination. Only military personnel, healthcare workers, and emergency responders can actually receive a vaccine. So smallpox is only left in 2 laboratories in the world. They're biosafety level 4 labs, one in US and one in Russia. They're frozen in liquid nitrogen, and there's been some controversy over whether or not they should be destroyed in an autoclave. But both countries have decided not to destroy it for the time being, and in the US, research is underway to try to map the genetic makeup of the variola virus because it's still relatively not understood. So one big threat that comes along with smallpox is bioterrorism, because it has been eradicated and much of the population now lacks immunity to it, it could become a very big threat if it were to be released again. Smallpox is very quickly transmitted, so in case of an epidemic, the CDC came up with the Smallpox Response Plan and Guidelines, and they also manufactured enough vaccine so that every person in the United States could be vaccinated in case of an emergency. Thank you.